In nursing, we have to have the opportunity to teach clinical skills, to be able to go to the bedside with the nursing students and show them in a hands-on way what they're supposed to do. The remote presence gave us the opportunity to do that. In addition, we do a number of community events and teaching nursing students to work with students in the high school system and in the elementary. The RP Express gave us the flexibility to take the faculty into the community to teach those students. We were in communities where the connectivity didn't necessarily always work, and we always had to have a backup plan. InTouch Health was always there for us. Best support that InTouch Health has provided to the College of Nursing is the opportunity to think differently. They actually push us to move this equipment in ways that perhaps they haven't used before and neither have we. And because they are so supportive and that they're willing to take those risks with us, we've been able to engage communities, engage the healthcare system with the education system, and move that beyond the province of Saskatchewan. I'm not sure that another company would be as progressive in connecting all of those dots that quickly and in areas where it hasn't been used before. So they're helping us to teach people without a lot of evidence to think differently, to be different, and to act different. Implementation of remote presence has allowed us to actually push that global initiative forward. A year ago, the CEO of the company said, "Put vision to action." Well, they actually do that. They enable that vision to come alive. And so we have been able to connect nurses in the circumpolar world to teach each other to actually realize that social determinants of health are not a problem just in your community. Without that support, without InTouch Health going to those communities with us, allowing us to teach nurses and physicians simultaneously, then we wouldn't be able to be successful. We have been able to open 2 sites in northern Saskatchewan and 1 in the south in a rural area. So we now can deliver nursing education through InTouch Health in both rural and remote regions. We have extended the remote areas of the north into the circumpolar world through InTouch Health with connections into Siberia, in Yakutsk, and also in Manila in the Philippines. And it is our goal to implement the remote presence in Tromsø in northern Norway by the end of this year. We can do that because of InTouch Health's connectivity and their transformation in thinking differently in terms of healthcare and healthcare systems.
We picked InTouch because of its reputation as an innovative leader in this area of remote presence telehealth. Having seen it on the coast in Canada already in use was my aha moment. It was, I'm always hesitant of new technologies because sometimes to be on the leading edge, sometimes you're on the bleeding edge. And so for us, I didn't want to bring something in that would scare the faculty or that wouldn't be effective with the students. And so when we saw it actually in action and how intuitive the interface was for a user to sit down and be able to get past the technology and just communicate, that was my aha moment. Well, InTouch Health's technology is very scalable, and that is actually one of their strengths. So when we look at network infrastructure, you have nodes, and when you have one-to-one, that's great. That serves a need. But as soon as you have one-to-many or many-to-many, you enhance that strength quite a bit. And so with InTouch Health, with their global presence, a network that exists, and our connections as an academic institution to a variety of circumpolar institutions, we're really able to leverage both of those networks and bring them together in a very meaningful way that will have a strong impact to patient care and interprofessional health across the world.